I want to start by assuring you that Emma was doing amazing work this entire year, all right? Don't let Jake let you think anything otherwise. Richmond, Virginia, like many other urban centers around this country, faces the challenge of extreme poverty. In our city, 26% of our residents and 44% of our children live below the poverty line. And what we know about poverty is that it has pervasive impacts on the health and well-being of people living there. And part of my job as a public health official is to try to help figure out what to do about that. So we started with the data. And a few years ago, we started to geomap things like life expectancy and teen pregnancy and infant mortality. And what we saw without exception is that the parts of the city that had the highest rates of disease were the same as the parts of the city that had the highest rates of poverty. And that was particularly true in communities like this, public housing in Richmond. So we took the data to our partners at the Housing Authority, and we said, we'd love to come alongside you and help figure out how to improve health here. And we were really pleasantly surprised by their answer. As it turns out, there are still folks in government who actually want to help people. And so the folks at the Public Housing Authority started to identify vacant units in the largest public housing developments around the city, and they gave them to us. We started talking to residents in these communities. And what we found in each of these housing developments was that there were a handful of people who not only knew something about health, but had incredible insight into the challenges that they and their neighbors were facing in trying to improve health. So we hired them. They became community health workers with us, and that profoundly changed the way that we were able to listen to and to learn from the residents of our community. What happened from there was this beautiful organic process of residents of these neighbors taking over sites like this, really becoming owners, helping to determine what clinical services we provided, or what educational opportunities we would provide, or what support groups they would become a part of. And we heard a lot about access to care. Now, access to care isn't the biggest determinant of health. What you eat, or whether or not you smoke, or the amount of stress you have in your lives are probably bigger ones. But it's an important one, and it's a really complicated one. We'd hear from our residents that they didn't know where they could go to see a doctor, or they didn't know how to manage the transportation and the child care challenges to get to that doctor. Or they didn't have the margin in their lives to make an appointment 4 weeks out and then to actually keep that appointment. And then there's this. But many people in Virginia can't get health insurance. We were one of the states that didn't expand Medicaid, and so there's still a number of folks who are uninsured. Now, this doesn't mean that they don't have any options. There are a number of partners around the city that actually provide services to the uninsured. But each of these partners has their own system, their own hoops to jump through, and it makes it that much more complicated to actually get access to these services. At the same time, I was talking to one of my colleagues, Andreas Addison, who was doing a project on the social services side. And he told me that 67% of social services beneficiaries had a smartphone that they used every day. And so we started to talk about how might we use that technology to solve this problem. Enter Code for America.
So Richmond has this network of organizations that do really great work providing care to people without insurance, but they have limited resources. So almost all of them have some sort of eligibility screening process that patients need to go through to prove that they really need this discounted care. So here's what this might look like for one patient. This is Sherry. Her knee's been hurting for a while, so she calls a clinic to see if she can make an appointment, and they tell her she needs to come in for a screening appointment first. They ask her to bring documents that prove her income, like pay stubs or tax returns, but she works a lot of odd jobs and doesn't really have a single employer, so it takes her a while to figure out what to bring. But eventually, she asks her sister to watch her kids and takes 2 buses downtown to the clinic early in the morning. The clinic only has a handful of screening appointments available each day, so people line up before it opens to get a slot. Today, Sherry's lucky, and she's able to get an appointment, but she still has to wait 5 hours for it. Eventually, she talks to the screening staff, and they help her through a paper application. Luckily, she's brought all the right documentation, otherwise she'd have to come back another day. And finally, Sherry gets to this point where she's approved and she can make a medical appointment for another day. But a lot of people drop out of the process before they get to this point, or they never start it. And if it turns out that Sherry needs care from somewhere else, she's going to have to go through this all over again. So this process is often really slow and confusing. For a lot of people, it's easier to just go to the emergency room when they get sick because it's always open and they'll receive care regardless of their ability to pay. So we wanted to find ways to make this process more efficient so that patients can get into care faster. And we also just wanted to make it less confusing and a better experience for everyone involved. Right now, this process is totally paper-based. So if a patient's at a clinic, filling out an application, and they're missing some information, they're probably going to have to come back another time. So we built a web app that collects all of the same information so that applications can be filled out anywhere. One thing we heard a lot was that patients were reluctant to start the screening process when they weren't sure whether they were close to qualifying because it is so long. So we built this pre-screening tool that lets people answer the most fundamental eligibility questions, which are usually household size, income, and current insurance status, and it gives them an estimate of whether they're likely to qualify. And that's not a definitive answer, but it can help people figure out whether it's worth filling out a full application that could be 100 questions. Right now, these processes are totally separate across organizations, so patients that need care from different places have to go through it again and again. But once this is online, it can be easily shared across organizations with the patient's permission so that they don't have to document their income again and again. There are community health workers and social workers in Richmond who are already spending a lot of time referring patients to these kinds of care programs. But right now, they usually can't do more than give people brochures and encourage them to follow up. But once the applications are online, they can actually help a patient fill out a full application and send it on. Those users were really interested in figuring out whether their referrals were effective. Was the application received, and was the patient eventually found eligible for care? And care providers were really interested in knowing where else a patient might be receiving care so that they can make sure they're not duplicating labs or medications. So we built this view that lets staff users see all of a patient's past referrals and screening results within the network. So here's what an alternative process might look like. When Sherry's knee hurts, she goes to talk to a community health worker in her neighborhood. She's not sure what she might be eligible for, so together they use the pre-screening tool to find a clinic that makes sense, and then fill out the application and send it on. The clinic can then review her information remotely and give her a call when she's approved, so she doesn't have to take a day off work just for the screening process. When she goes to the office, she can go straight to a medical appointment, and when it turns out that they need to refer her elsewhere for an MRI, they can send her screening information on easily. So we've been testing this prototype with staff users in Richmond for a few months now, and we're preparing for our first set of tests with real patients. But one thing we've been thinking about a lot moving forward is how application forms vary across organizations. So this chart shows all the different ways that different application forms ask about kinds of income that you might have. So some of them are asking about food stamps, some ask about Social Security, one asks for your income as tips separated out. So there are hundreds of unique questions, but it really always comes down to household size and income. So as we tried to build a web form that asked all of these questions, we started talking to our partners a lot about whether all the questions really needed to be asked the exact way that they were worded, and whether we could make the forms more similar across organizations.
And what Emma just talked about, the problem that she just shared, really gets at the heart of our challenge. There's an old joke in Richmond that says, how many Richmonders does it take to change a light bulb? The answer is 4. 1 to unscrew the bulb, and 3 to talk about how great the old one was. Now, while our city has changed dramatically, some of our institutional thinking has not. Our Code for America fellows have been brilliant. They have created an elegant, simple-to-use technological solution. But perhaps more impressively, they have leveraged this technology to start the process of systems change in organizations like mine at the health department. They've helped us and many of our partners start to reorient what we do to the people that we're trying to serve, to the people that have to use the systems that we've created. And at the end of the day, for us in government especially, isn't that what it's all about, the people? We have had an incredible experience with these folks, and it has helped us think differently in Richmond about the role of government. We need to get back to the people. Thank you.